Miriam Dominguez here at Kings United Way. I hope everyone had a wonderful weekend. Thank you for joining us today. This webinar will cover HMIS data standard revisions. If you have any questions regarding today's webinar, please ask them in the chat box and we will review them at the end of the webinar. Also, this webinar is being recorded. If you would like a copy, please indicate it in the chat box, or you can always send an email to Lucia or myself. And your presenter for today will be Lucia Orozco. Again, thank you again for joining us today.
Good morning, everyone. Today's webinar, we will be covering the 2017 HMIS updates. These updates have been effective as of yesterday, October 1st, 2017, and they have been deployed in your environments. As of this morning, you may have noticed that there are new work groups on there, and those new work groups have all the new HMIS data updates. We have been covering them briefly in the last few webinars that we've had in the trainings, but we will be going over them in much more detail today. Like Miriam mentioned, if you have any questions at any time, please feel free to add that into the chat box. It will be recorded, so we will be sending it out later. Okay, we'll go ahead and get started. The first update pertains to gender, client gender. The changes here are to the responses. It is applicable to all project types, and the changes are to the response number 2, the trans female, male to female, which the definition reads as clients who live or identify as women even though they were assigned male at birth. And then trans male, female to male, clients who live or identify as men even though they were assigned female at birth. And then they have added gender nonconforming, not exclusively male or female. And the definition of that response is clients who do not identify exclusively as male or female. So it's just a couple changes to the responses here. It is still required for all project types. The next update is with the disabling condition. It is now a universal data element. Before it was included in the client demographics where veteran status was, but now it will be in the universal data element. I've been testing these work groups and I have been actually kind of missing it. So it is a required field. So if you do miss it, it will give you an alert to go back and add that. The responses have not changed. It's still a yes or no question. And I did add here the definition of the definition of the disabling condition, which is a physical, mental, or emotional impairment, including an impairment caused by alcohol or drug abuse, post-traumatic stress disorder, or brain injury, that one is expected to be of long and definite duration, and two, substantially impedes an individual's ability to live independently, and 3, it could be improved by the provisions of more suitable housing conditions. A developmental disability as defined in Section 102 of the Developmental Disabilities Assistance and Bill of Rights Act of 2000, or the disease of acquired immunodeficiency syndrome, or any condition arising from the etiologic agency for acquired immune deficiency syndrome. So it's basically just a barrier that impedes them from living day to day. The next update is with the project start date. What they've done here is added a little bit more definition to this data element. It is applicable to all project types. So as you could see here, the biggest change is with projects that are with the permanent housing. For example, permanent supportive housing and rapid rehousing. I'm going to go briefly through these. So project start date is defined for street outreach as the first date of contact with the client. It's defined for emergency shelters as the night the client first stayed in the shelter. Night-by-night shelters will have a project start date and will allow clients to re-enter as necessary without existing or restarting for each stay for a specific period. So the difference between a regular emergency shelter and a night-by-night shelter is that an emergency shelter compares entry versus exit, and it is expected for the client to be coming back on a nightly basis from the project start date to the exit date. In a night-by-night shelter, it's they may have an open enrollment in the project, but will only come and stay separate nights. They may or may not come back the following night, and they're not guaranteed a bed. For transitional housing, it's the date the client moves into the residential project, or, for example, the first night in the residence. For permanent housing, including rapid rehousing, it is a date following the application that the client was admitted into the project. So it doesn't necessarily mean that the client's already been housed, but it is a date that the following factors have been met. 1, the information provided by the client or from the referral indicates that they meet the criteria for admission. 2, the client has indicated they want to be housed in the project. And 3, the client is able to access services and housing through the project. The expectation is that the project has a housing opening or expects to have one in a reasonable short amount of time. And then other service projects, including services only, a day shelter, homeless prevention, coordinated assessment, is a date that the client first began working with the project and generally received the first service. Destination, the only changes here, which is applicable to all project types, are a couple of responses have changed. The first one is permanent housing for formerly homeless persons. They've added the, in parentheses, other than rapid rehousing. And then they've also added an additional response, which is rental by client with rapid rehousing or equivalent subsidy. So that's the only change there for destination. The housing move-in date, this data element is only applicable for permanent supportive housing and rapid rehousing projects. So they moved this data element from the program-specific to the universal data element. And it is now applicable to permanent supportive housing projects, which before it was only applicable to rapid rehousing. Now it's also required for permanent supportive housing projects. And the definition for the housing move-in date is the date the client moved into housing. This may or may not be the date that the client entered the project. Next, we have living situation, which is also required for all project types. They have split this into 2 sub-elements, and then 2 of the responses have changed for prior living situation. One is permanent, not changed, I'm sorry, they just reworded a little bit. The first is permanent housing for formerly homeless persons. So in parentheses, they added other than rapid rehousing. And then they changed rental by client with other housing subsidy. They have added in parentheses, including rapid rehousing. So they've just been a little bit more, it has a little bit more description and more definition to that. So these are the 2 subsets. So it depends what type of project you are, you're entering your client into. You'll either get 3.917A or you'll get 3.917B. So if you're entering your client into a street outreach or an emergency shelter, the questions, you will see all 5 questions. You will see where was the client just before project start date. It's not worded exactly the same, but these are the questions. Number 2, how long ago did the client start staying in that place? So length of stay. Number 3, how long has the client been in a literal homeless situation? Number 4, how many times has the client been in a literal homeless situation in the last 3 years? And number 5, how many cumulative months has the client been in literal homeless situations in the past 3 years? So how many episodes of homelessness? Then if you're entering the client into any other type of project, for example, transitional housing, rapid rehousing, permanent supportive housing, homeless prevention, you will get only the first 2 questions. Where was the client just before project start? So previous residence, and how long ago did the client start staying in that place? So length of stay at the previous location. So depending on your responses for those 2 questions, you will either get, if you go down the homeless situation, which you will get the additional 3 questions, which are how long has a client been in a literal homeless situation? 4, how many times has a client been in a literal homeless situation in the past 3 years? And 5, how many cumulative months has a client been in literal homeless situation in the past 3 years? However, if this is only if the response for question number 1 was a homeless situation. If their prior residence was an institutional or transitional or permanent situation, for example, rental by client or owned by client, or permanent supportive housing or transitional housing, or an institutional setting like psychiatric facility or hospital or jail, then you're going to get the next question, which is 2A. Was the stay in an institution for less than 90 days, or if it was a permanent or transitional housing situation, was the length of stay less than 7 days? So depending on how you respond to those questions, you will either, if you respond no to the question, the questions will stop. You will no longer need additional questions. However, if you respond yes, it will prompt you to add a response for the next question, which is to be on the night before that. So before their institution stay or their permanent or transitional housing stay, were they on the street, in a shelter, or in a safe haven? So if that is a yes, they would continue to answer the questions 3, 4, and 5. How long has a client been homeless? How many times? And total number of months in the last 3 years. If they answer no to that question, then it stops right there. You really won't see a difference in the work group depending on the project type you're entering the client into, or the type of response that you've selected for number 1 and 2. It will prompt you through. It uses conditional logic, so you don't have to worry about which questions you do need to answer and which ones you don't to meet these requirements. It will take you through the ones that you do need to respond to. Okay, next change is the housing status. This question has been dropped. It is no longer required or applicable to any project types. The next changes are to the income and sources, which is applicable to HUD, ESG, PATH, SSVF, and VASH projects. And the changes here are that they changed the wording from Social Security Disability Income to Social Security Disability Insurance. They have corrected that. Next, we have the non-cash benefits, also applicable to HUD, ESG, PATH, SSVF, and VASH projects. They have removed some responses here. They have removed Section 8 public housing or rental assistance. They've removed that option, as well as temporary rental assistance. Those 2 options will no longer be listed under the non-cash benefits. Okay, 4.5 through 4.10 are all the barriers. We have about 7 barriers. We have physical disability, alcohol abuse, drug abuse, mental health disability, chronic health condition. What are the other ones? HIV, AIDS, and I believe I missed physical disability. So for these questions, they're applicable to all HUD, COC, ESG, PATH, and VASH projects. They have removed the dependent responses. So before, where if you were to select yes for a specific barrier, you would get 3 additional questions that you would need to answer. They were documentation of disability and severity on file, and currently receiving services treatment for this disability, and the third was if the condition was indefinite. The documentation and disability on file and receiving treatment or services have been dropped. They are no longer required. So if you select yes for any specific barrier, the only additional question you need to answer is if the condition is indefinite. You will see that change now in your work groups. Next, we have contact, which is applicable to all emergency shelters, street outreach, and services only project types. And here the change is that they've changed the location of contact question to, or they've reworded it to staying on the streets, emergency shelter, or safe haven. So that's just a simple yes or no, refused, don't know, or data not collected question. The data collection stage, which is also applicable to all project types, specifically the ones that are projects that go over a year or more. They have added an additional assessment type, which is the post-exit. This is only optional. It is not required for projects, but the definition of a post-exit assessment type indicates that the element may be collected after project exit for a period of no longer than 6 months. So here, if the client exited on April 1st, you can technically go back and add a assessment that is post-exit after the client has exited your project for a period no longer than 6 months. And then they've also given a better definition of the annual assessment. So for projects that have clients that serve clients for over a year, they are required to complete an annual assessment. At a minimum, an annual assessment must be completed for every adult in the household. So they've added the definition, and I'm going to go through that. There should be one and only one record for each data element annually, with the data collection stage recorded as annual assessment, associated with any given client and enrollment ID within the 60-day period surrounding the anniversary of the head of household's project start date. So there are project entry, project exit, during program enrollment, other, and now they've added post-exit. In order to meet this requirement, that assessment, the annual assessment, must be recorded as annual assessment type. If you add an assessment and you select during program enrollment, it will not satisfy this requirement. In addition to that, it has to be within a 60-day period surrounding the anniversary date of the head of household entry date. So it could be 30 days prior to that date or 30 days after that date, but it can't go beyond that. And an annual assessment must include an update of both the head of household's record and any other family members at the same time. So, for example, if it's a household that consists of the self and the spouse, but the spouse came in 6 months after the head of household. For some reason, the spouse didn't join the head of household at the same time. That spouse came 6 months later. So the head of household will have a start date of, say, August 1st, and the spouse may have a start date of January 1st. The annual assessment for the spouse, which entered on January 1st, that annual assessment must also be dated at the same time as the head of households, which in this situation, or this example, would be August 1st. So even if they didn't enter with the head of household, their annual assessment must be recorded on the same date of the head of household. I hope that makes sense. If you guys have any questions around that, please feel free to add it in the chat box or contact me after the training. Another change, which is in regards to the last grade completed, which is only applicable to all SSVF and VASH related projects, is the collection point for this field. Prior to this change, to these updates, the last grade completed was only required at entry, and now they have added to also require that at project exit. So now last grade completed response has to be collected at project entry and project exit for SSVF and VASH projects. In addition to that, the VAMC station number, just a small change here, which is only applicable again to SSVF and VASH projects. They have changed that from a text field to a drop-down. So before, where you'd have to actually type it out, now you can just select the drop-down and find the station number that is for your specific project, which I believe is Fresno for our area, and then save that. Okay. The local implementation here, and like I had mentioned at the beginning, it is effective for all persons served, regardless of project type, on October 1st, 2017, which was yesterday. Changes go live today, which actually they already happened this morning. So if you experience any difficulties this morning, we apologize for that. We were trying to make that switch. every user in the system has a new work group. And if your work group does not have 2017 at the end, then you do not have the correct work group, so please contact me. And then last thing is the updated forms will be released tomorrow. So these forms will reflect all the changes, all the rewording, the flow, everything. So I'm assuming that will be sent out via listserv. And that's it. With any sync that we have, any updates that we have, there's always room for errors, and there's always a risk for things not working out as well as we would want them to. So if you do notice something in your work group that is either not working correctly or was there but you don't longer have access to, please contact either Miriam at miriamd@keensunitedway.org or myself at luciao@keensunitedway.org, or you can contact either of us by phone at 559-584-1536. And I think that's it. We'll open it up for questions, and thank you. I don't see any questions at this time. We will send out the recording. And again, if you have any questions, concerns, anything at all, please let us know. We'll be more than happy to help. Okay, so I think that's it for today. And I do appreciate your guys' time. I hope you guys all have a great day. Thank you.